Hi. Today I want to talk to you about exercising after spinal cord injury. Spinal cord injuries, or SCIs, affect 17,000 Americans a year and constitute anything that results in changes in muscle function, sensation, or our body's internally regulated systems that the spinal cord controls. Before you get started, it's important to understand spinal cord injuries have varying degrees of severity, and because of that, there may be certain exercises that are difficult to perform. Also, depending on how recent your injury was, your doctor may not feel your spine is stable enough for any resistive or rigorous activity. Likewise, if it's been a longer period of time since your injury, you'll need to consider the health of your bones and muscles. Persons with spinal cord injuries are at an increased risk of osteoporosis. This makes bones more susceptible to injury or fracture. However, keep in mind that if you have osteoporosis, exercise can help. Strength training, weight bearing, and flexibility exercises done correctly and safely can actually reduce your risk for osteoporosis. Another medical issue you need to be aware of is autonomic dysreflexia. This is a potentially life-threatening medical emergency that affects individuals with injuries at the level of T6 or higher, causing their blood pressure to rise. Once triggered, it's important to act quickly, as often simple actions can correct the situation quickly and effectively. Symptoms may include nausea, pounding headache, a red or flushed face, sweating above your level of injury, or even goosebumps below your level of injury. If you experience one or several of these symptoms while exercising, stop immediately. Begin checking things like your bowel and bladder. Perhaps you need to cath. Even something as simple as clothing that is too tight may be a cause. If you can correct the issue quickly, great. If not, please call your physician or 911, as this is a medical emergency. When determining what exercises or activity may be right for you, it's important to take into account what positions are required or what types of equipment are used. Depending on your level of injury, you may need to seek out a gym or clinic that offers adaptive exercise equipment. These are pieces of gym equipment that accommodate wheelchairs or have adapted handles and seating surfaces that meet your individual needs. It may also be wise to find a friend or someone to assist you with equipment setup, positioning, or transfers. Alternative exercise options may be wheelchair-based exercise groups that focus on flexibility and function, such as seated Tai Chi or yoga. Many people find that by improving strength and flexibility, their transfers and abilities with other functional tasks improve. Also, many individuals with an SCI enjoy water-based exercises, as it is often easier to perform standing movements or support body weight than it is on land. Once you've identified an activity or program that you're interested in, you'll need to become familiar with what movements are required and how they may impact your health. Spinal cord injury patients rely heavily on their arms for mobility. Our wrists, elbows, and shoulders were never meant to bear our weight or provide the repetitive forces necessary for wheelchair propulsion. So adding high repetition, high force exercises to these joints could be harmful. Try to avoid any overhead exercises or those that contain potentially harmful positions, such as internal rotation and abduction. Studies suggest close to 75% of people with SCI experience upper extremity pain or shoulder problems. This is in part due to the increasing demands on their arms from everything from transfers to wheelchair propulsion, and even from basic daily living tasks. Exercise can help patients build strength and gain flexibility that, when done correctly, can help prevent injuries to their arms. The STOMPS protocol is one such program. We've included a demonstration to help you get started. No matter what you decide to do, it's important that you do it safely and that it brings you enjoyment. Exercise shouldn't be painful and can provide you with a lifetime of healthy living after your injury. If you have any questions on how to get started, be sure to reach out to a qualified healthcare professional. And thanks for watching.